Good afternoon. Can everyone hear me? Nod? Yes. Um, I know people are kind of trickling in. We'll give everyone maybe about a minute or so, and then we'll get started, okay? Okay, good afternoon. I see that all the advisory members are present, and I want to be respectful of everyone's time. So, welcome to the inaugural first Mental Health Parity Advisory Committee meeting. It's very exciting. Um, it's been a long time coming, and we have arrived in 2020, even in a pandemic. So I thank everybody for participating and for jumping on. We just want to do some quick housekeeping um, items before we jump into the meat of the agenda. We are testing out the technology that's going to be the best thing for us. And so we want to make sure if you want to speak that you raise your hand as advised on the slide. There will be a slight delay between the time that you raise your hand and Mary is able to unmute you. Make sure that you also look for the pop-up to allow the unmute to happen. Also, just so you're aware, the meeting is being recorded. So we are following open meeting law, so it's being recorded, and we are going to continue to move forward and find the best technology as we move forward for our next meetings, so it won't be so cumbersome moving forward. So as we get started, we're very excited to have. We're gonna have some slight adjustments to the agenda. We're going to start with Christina Corriere from the governor's office. She's going to have some words with us and some welcome words as well. So, Christina, if you are ready, the floor is yours. Thank you for coming.
Hi, thank you so much, Lynette, and thank you to everyone on the call today. This committee's work is very important. This was obviously an issue that the governor felt strongly about last year as we were working through this legislation. In particular, that access to behavioral health care should be no more difficult than access to physical health care. But while January and February, when we started to work on this bill, we knew the general importance. I think the pandemic shined an even greater light on that. We know that behavioral health has become a bigger challenge as we've dealt with about 9 months of COVID-19. We're seeing increased depression, increased anxiety, and social isolation. So, making sure that people who are going through that have access to the healthcare they need has become more important than ever. So, this committee has important work to do. I will try to participate as much as I am possible to do that through the legislative session. But I wanted to thank all of you who've been willing to serve on this committee, the parents that have had children who've had to access or had difficulty accessing the behavioral health system, the providers who work directly with the people in need, and the insurance companies who have stepped up to the plate to work with us on this. So thank you all, and thank you to Dr. Lynette Hannigan. We have brought her on to join the Department of Insurance, again, as part of that mental health parity bill, so that there is always somebody focused on that issue over at DOI. So thank you again.
Thank you so much, and we are excited. I'm excited to be on board to help move things forward, so thank you again. Next, we will have some words of welcome from Director Evan Daniels. The floor is yours when you're ready.
Thank you, Lynette, and thank you, Christina, for your words, and thanks to all of you for being here and being willing to serve our state in this capacity on this advisory committee. As Lynette mentioned, my name is Evan Daniels. I'm the Director of the Department of Insurance and Financial Institutions, and it's an honor to be tasked with implementing this part of Jake's Law and putting together this committee and beginning the important work of putting together rules that will govern the parity process for, and hopefully will make access to mental health care smoother, more clear, and provide certainty for everybody, both on the side of those who need the care and the insurers who, in many cases, will be paying for it. As Christina mentioned, I think the last 9 months has really emphasized how important this work is. And certainly I have some personal experience myself with dealing with family members who have required mental health treatment. So I know personally how much this means and how important it is for this type of thing, the access and treatment of mental health conditions. I know how important it is to everybody on this call. And I know we're all starting from a place of wanting to do the best for our state, for the citizens, for the communities that we serve, and of course the stakeholders that each of us represents. We all have a role to play, and an important one at that. So let me just say thank you again. Welcome to all of you. I'm looking forward to getting to know you. I'm looking forward to having Lynette work with you. As Christina mentioned, we're really excited to have Lynette on board to be our point person for this process. And hopefully, as you all get to know her, you will come to appreciate the depth of her experience and knowledge and her as a person as we have in the short time that she's been with us thus far. There are others in the department who you likely will all get to know at some point. Mary Boatwright, who is acting as our impromptu host for this session. Thank you, Mary, for being willing to take on the technology part of this. Erin Klug, who's also on board here. You likely will be hearing from both of them quite a bit. And there are others in the department who I expect you will come to know through this process. Our goal is to, of course, facilitate discussion, to hear from the stakeholders as we put these rules, these what will become the rules together, and promulgate them out. You can expect that you will always find us ready to listen. We take that seriously. We want to hear from you. For both those of you on the committee and those of you who are just interested in the outcome here, please do not hesitate to reach out to us, to let us hear from you. Obviously, I don't expect, as these processes tend to go, I don't expect that everyone will agree all the time, but I do expect and I know that everyone will approach it in good faith and seeking and trying to do the right thing for our state. So with that, thank you very much. We can get back to the agenda that Lynette has put together, and we're very excited to be working with you all. Thank you.
Thank you, Director Evans, for those words. Now we want to introduce the committee members. I am going to call on you, and then Mary's going to unmute you so you know that your turn is coming. We're excited to meet everybody on the committee. When you introduce yourself, please tell us your name. What area are you in? Are you a family member? Are you a provider? And just a little bit of what your interest is for being on the committee and what you're expecting as we move forward and what you want to contribute. So we will start with Angela Gamboa. Great to have you on the team. Mary will be unmuting you shortly.
Hello. Can you guys hear me?
Yes.
Hi. Sorry, I'm losing my voice. I'm sick right now. My name is Angela Gamboa, and I am interested in this because I lost my son Jacob at 16 years old to suicide in 2018. And Jake's Law is really important to me because a lot of the things that Jake's Law is about happened to my son. And I'm just really happy to be on the board and excited to meet all of you and work together.
Thank you, and I hope you feel good.
Thank you.
Mary's going to in, or if you go down and mute yourself, and then we will move on to Carly Fleege. Welcome to the committee.
Hi guys, Carly Fleege. I am here because I lost my little sister to suicide. It will be 4 years ago in January, and through my experience meeting with other folks who have lost a family member or a loved one to suicide, I have dedicated myself to doing what I can to help implement policies that will reduce the number of suicides in our state.
Thank you, Carly. Our next committee member I want to introduce is David Carnahan.
Hi, good afternoon, everybody. I'm Dave Carnahan. I'm the CEO for Quail Run Behavioral Health Hospital in Phoenix. And the reason that I'm here is as a provider of inpatient and outpatient services, we see every day where parity, where some of the struggles are with parity in behavioral health as it compares to medical. And certainly there's a lot of opportunity to make improvements in this area, and I'm real excited to be on the team. So thank you very much.
Thank you, David. Our next committee member is Dr. Don Fowles. Dr. Fowles, are you still with us? I saw you on. He might be having some technical difficulties. We'll loop back around. Our next committee member I want to introduce is Jasmine Snipes.
Hi, everyone. I'm Jasmine Snipes. I'm a family member, and I am deeply interested in equity, accessibility, and what it looks like to address that.
Thank you, Jasmine. Welcome. Our committee member we want to introduce is Carrie Steving. Carrie, are you with us?
It looks like Carrie might not be joined
Okay.
with the audio. She is on the video, but not the audio.
Okay. So we will move on to our next committee member, Kathy Busby.
Hello? Can you hear me? Hello? Okay. Yes, this is Kathy Busby, and I'm here on behalf of the Arizona Council of Human Service Providers. They represent over 100 behavioral health and child welfare agencies across the state. So we have a lot of providers who've been involved in behavioral health for a number of years, both Medicaid as well as commercial insurance. So they all have a great interest as well as a depth of and wealth of information and knowledge of what problems are and what's currently going on and suggestions to how to improve. Thank you.
Thank you, Kathy. Our next committee member we would like to introduce is Monica Kurt.
Hi, and thank you for having me. I'm Monica Corey, and I work with Arizona Complete Health, which serves, individuals in Access, Marketplace, and Medicare. I'm an attorney by training, but I've been working on the integration of the healthcare system for many, many years, 10 years with Access before joining my current role. And it's just a personal passion and commitment of mine to drive our healthcare system towards whole person health. So I'm very honored to be part of the group. Thank you.
Thank you so much and welcome. Our next committee member is Rogers Wilson. Okay, maybe he's having some technical.
Hey, Lynette, for what it's worth, I finally got unmuted here, so this is Don.
Well, we will go back to you, Dr. Fowles. You have the floor.
Yeah, thank you. Don Fowles, and first off, really appreciate the opportunity to serve with everyone here. This is an incredibly important issue, and much more so during COVID and opioids and other things in our community and nation. I come at this as from a couple backgrounds, actually three. One is as a managed care person, but also as a provider and also as a family member. I've been in all three roles and want to try to contribute from that perspective. And I think in terms of expectations, I think you put together a really good group. I look forward to collaborating with everyone. And I know there are different schools of thought and ways of looking at everything, but I think, with this issue, it's sort of rising above wherever our particular silos are and really trying to do what's right for people, members, patients, families in our community. So thanks again. Appreciate it.
Thank you and welcome. And then our last committee member. Are you with us?
Yes, I think I'm unmuted. I'm Vista Thompson. I'm a director of legal services at Blue Cross Blue Shield of Arizona, so representing an insurer perspective. I have been the attorney assigned to work on mental health parity compliance since the federal rules went into effect back in 2014. And so I brought a show and tell. This is my mental health parity notebook that I refer to frequently as one of two. So it's an interest or a subject matter of keen interest to me. And I am probably not alone. I have a family member who committed suicide. It was devastating for the parents. And I just can't imagine what that's like. But I think as an insurance company, we recognize that it's important to take care of our members holistically, and that medical services enough, or not, alone are not enough. You have to take care of the integrated human being, and you help them to do better when you are providing benefits and being compliant, on both sides of the equation. So I'm very honored to be included in this committee, and I look forward to working with everyone.
Thank you so much. And just to
Hi.
There.
Hi. I don't want to leave anybody.
Oh, no problem. Hi, I'm Rogers Wilson. I'm happy to be here. This is something I'm very passionate about. Presently, I'm the market exec for Cigna of Arizona, previously the CMO of HealthNet of Arizona, also formerly the state medical director for behavioral health. So I do bring a administrative and a provider's view, but I also have a nephew in the system who is SMI. So this is definitely something I'm passionate about. I will be happy to work with everyone here. Thank you.
Thank you so much. And Carrie, I saw that you were on.
Yeah, I'm hoping. Can you hear me? Are you able? Oh, okay. Perfect. I have odd mute issues. I'm Carrie Steving. I have a couple of roles. First, let me say that I'm very honored and excited, if excitement is the right word to utilize in this situation, but to be a part of this and hopefully a part of the solution to make things better for our kids and families. But I definitely come to it from a couple of different angles. First and foremost, I consider myself a family member. My mom has a serious mental illness and has had depression and kind of battled suicidal ideation her whole life. So I think the idea of having to access care for her has been just a part of my upbringing. So incredibly important, and I'm very passionate about it from a slightly different lens. I've also worked in the behavioral health system in Maricopa County for the past 20 plus years. Currently, I'm the Children's Systemic Care Administrator for Mercy Care, which serves my scope serves the Medicaid population for child welfare and for general mental health, and our DDD population, so targeted towards kids. So definitely a topic, obviously, that we address every day, and always looking for opportunities to figure out better and different ways to do that. We also are now statewide with DDD and child welfare. So Maricopa kind of focused, but also have we will be statewide for our child welfare April 1st of 2021. So wanting to be really thoughtful around the nuances of the state and the different areas. But very excited to be here. Thank you so much, and look forward to working with everybody.
Thank you so much. And just to round out everything, so wear hats as well. I'm a provider. 12, 15 years. Started in case management and worked my way up through the ranks. I also have side in the past as in our family. I have members in my family that suffer from addiction. And so I think just the different hats I have worn professionally and what I've experienced personally, hope to offer some diverse viewpoint to the group, and we can do a lot of great work. So excited to be on board. Okay, let's jump into some of the meat of this. Today, we just want to be real cognizant of level setting and look at what as an advisory committee, what our role is. And we have a slide that we took directly from Jake's Law of what the advisory committee is to do or how we are to guide. And I know everyone can read, but I will just highlight it that we are an advisory committee that has been established to advise the directors of the Department of Insurance and Financial Institutions and the Department of Health Services relating to matters pertinent to mental health parity, including recommendations related to case management, discharge planning, and expedited review and appeals process for cases involving suicidal ideation. So we have our work cut out for us, and a lot to do, and there is a lot there that we are going to address. So what I want to start with is asking the committee members, one of the things we are tasked to do is have a website that hopefully is to educate. Our agendas will be there, our recordings will live there. We are going to address information about mental health parity from a general standpoint. We want to be able to guide people, but what, as a committee member, are you hoping to see put on this website for our community? And I think Mary, if you raise your hand function, Mary will unmute you so you can give comment.
Hi, this is Carly. I've put some thought, though I probably can do a little bit more research into what other states are doing. But I think, something that almost either like flowcharts or in a way helps people get to understand whether their particular issue may be a parity violation. And then also a way to help people understand whether their issue is something that the State Department of Insurance can address, or whether it's something that they would need to contact the Department of Labor about. So kind of interactive in a way that will help drive people to the right place to seek help.
Okay. I love.
Oops, sorry. Didn't mean to do that again.
That's okay. I see Dr. Fowles has his hand up.
So one thing I think that the website could really help with is clarity on the bill itself. Just something up there that anyone who came to the site would say, okay, here's what the federal bill is, here's what it looks like in Arizona, and just in clear, as simple terms as it can be. I mean, it's a complex bill, and there's a lot to it, and a lot of opinions on it. But I think something that was very clearly put on the website that people could refer to would be helpful.
Okay. Anyone else? I saw Carrie's hand.
Yes, hello, this is Carrie. I was just going to say, I think that either there's two ways to do this. I think there are some exceptional resources and websites out there around resources if you do have somebody that you suspect has suicidal ideation, or if you have somebody that's experiencing suicidal ideation, where they can go. So either links to kind of existing resources around there, and then if not, resources of what to do, how to get help, and kind of connecting some of the dots for folks and making it really easy that if I have someone in this situation, what should I be doing, or what can I do?
Okay. Vista, I saw your hand up as well.
Yes. I'm not sure if am I unmuted? Can you hear me? Okay. It was really helpful for me to hear just a little bit of the consumer perspective, because when you get so immersed in the law, it's hard to tell, what is going to be helpful to somebody who's searching, who needs help. But just hearing some of what you're talking about, the division between, what can go to the Department of Insurance versus what can go to the Department of Labor, having a Q&A like that for people that they could turn to that is sort of state focused, because I think on the federal websites, there's a lot of information, but that may not be the first place that an Arizona consumer would turn. So a set of FAQs, if I have this problem, where do I go? Who can I call? Might be a way to get at it.
Okay. Carly?
I just kind of want to reiterate that I think consumers often find themselves overwhelmed with information. And so I don't want it to be something where it is a page filled with legal jargon or links to other resources. I mean, I think there needs to be a strong balance so that, we're helping consumers understand, but in a way that's really approachable because, I've done plenty of Googling and clicking through links and everything. And at some level, it just becomes information overload. And I'm still not sure whether I have the information that I need.
Okay. Yeah, we definitely don't want to overload anyone because there is a great deal of information. So if there's too much, it almost does a disservice than helping. So we definitely will be mindful of that. I thought I saw someone else's hand, but maybe not. Yes, Jasmine.
I would like to see, I don't know if implementation is the right word, but of some cultural competence. Because when we're talking about parity, maybe that language doesn't look the same for certain people from different cultures. And also making sure that maybe we address how that might impact people's accessibility. Does that make sense?
Yes, it does. Thank you.
Hey, Lynette. Erin. Can you hear me?
Erin. Yes.
Hi. I first of all, I hope folks will continue to give suggestions, but one idea might be we're working on fleshing out some content on the website now, and we're probably going to post. Well, we have to post something before by 1/1. So maybe we can encourage the committee members to. Once we'll let you know when the content gets updated on the website, and you can all go take a look at it, and then give us feedback. Either you can email Dr. Hennigan if you have specific comments or feedback about the content. We can certainly put the website on a future agenda if we want to have another discussion about it. But just wanted you to know we're actively working on it, and we're gonna start with something. We expect that the website content will be very iterative. And will evolve over time. And we're just really excited to have input from this diverse group of people to help us get it right. So I know one of the topics we're thinking about are, because we're insurance, we're thinking about something, some kind of resource on there to help folks navigate their insurance. Obviously, we're going to also have resources for healthcare appeals, surprise out of network billing issues, and that kind of good stuff too. So, okay. That's all. Thank you.
Thank you, Erin. Yes, so the first run, the initial one, it won't be as robust to start. It will evolve to that. In the statutes we have in there, but we're definitely hoping for it can be as robust as we can make it, and it'll hopefully be so. It'll just and back. How's your hand up again? Maybe not.
There we go. Yeah, this is something to think about, more a consideration than maybe a day one type of thing. But I think it'd be kind of interesting and useful to have a place on the site that showed how the advisory committee and we were working together to come up with solutions. And so this probably warrants a little more thought than just what I'm saying here. But so, there's, we all come from different backgrounds. There's biases and prejudices of all sorts, but I think the people, I know a lot of the people on the committee, and I think everyone really brings a lot to the table, has some really shared interests, even though they work in different places. And I think it would be a strong message to the community, if we can do this, and if we can, it's fine, but to show how providers, managed care organizations, advocates, family members can actually work together to get something done. And I think particularly in this day and age, that sort of collaborative voice would be a real positive influence in our community. So I just wanted to put that out there as something to think about how we might be able to do.
That's good. Thank you. Anyone else? And we've almost overlapped into both topics about consumer education materials as well. Some of you have mentioned what you would like to see and that we want to make sure that we're providing. Anything else on website or consumer education materials?
Lynette, we have had some comments in the chat from Monica Corey and Kathy Busby, so I believe Monica is unmuted now.
Okay, thank you.
Thank you. Yeah, I think Kathy echoed one of my comments, which was basically and goes to an earlier point I think Carly raised about not having an overly complicated website. But one of the things I'd like to see is just some basic information about how to access services. And one good resource is to promote the crisis lines that are operated throughout the state. A lot of people don't know about that resource. It's available to everybody, regardless of whether you have insurance or not. It doesn't matter what your insurance is, if you're Access or Blue Cross or uninsured, those crisis line providers are there to support everybody. So that's just a good way then to also get referrals to other services. So that was one thing that I was thinking, is just that basic information about how to get your foot in the door to access services.
That's good too. And Mary, you said there was somebody else that had comment?
Yeah, yes, and it looks like Kathy Busby is now unmuted.
Okay.
Yes. Somewhat on the same lines, talking with Monica and Carly, keeping it simple. And I thought perhaps some sort of FAQ section where somebody wants to know, how do I file a complaint? How do I get a hold of my provider, or rather my health plan? How do I get hold of crisis? Just some things so it might be easier for them, depending on what their topic might be, to navigate.
Okay. Thank you. Did I miss anyone else? All right. This is a good jumping off point. Thank you, everyone, for your input on those two topics. We're going to go down to rules. And actually, I'll reverse it for a quick second. Any other tasks, because rules is going to overflow into the status of rules. Any other tasks that the committee can think overall that you're hoping to tackle while we're, as we're doing our work, other than the website, other than the rules is a big chunk of what we want to tackle. Any other tasks as an advisory committee that you think we need to take on? Maybe the rules is enough. This is our first meeting, and as we meet and discuss, and as the rules come out and I'm sure that there will be other tasks that we'll say, we want to tackle that as well. And so if you think of something, definitely shoot an email. We will maybe looking at things and are feverishly working to get those done. And I believe I saw Mary Pazinski on, who has a status of rules update. Mary, if you're on, the floor is yours, so you can give us an update of where we are at with the rules. I thought I heard something.
Can you hear me?
Yes, I can.
Okay, great. First of all, I apologize. I don't have a camera because I have an old state computer, and it was like before they invented cameras on computers. So I'm like the voice behind the curtain. So I apologize for that. Secondly, I just wanted to give like a little overview of how rules work and then where we are in the process. The one overarching thing, even though rules may seem to be a little bit cumbersome, the overarching goal of all rulemaking is to keep the public, is to get constant public input and keep the public engaged in a rulemaking. Rulemaking is not a secretive process. It's all done out in the open. And so there are a lot of processes that are involved in trying to keep it an open process for the public to have ready access to what an agency is doing. So there's basically 4 steps to a regular rulemaking, and this is a regular rulemaking. The first step is to open a docket. And the way you open a docket is, the first step is to get an exemption from the rule moratorium that has been imposed by the governor through executive order. You have to go to the governor's office and ask them to give us an exemption to the rulemaking moratorium. Christina Corriere, who's our policy advisor and who's on this call, she's already granted an exemption to the governor's moratorium for this rulemaking. So we got the exemption, and then the docket is a notice that we submit to the Secretary of State, and the Secretary of State publishes that docket opening in the Arizona Register. And if anyone wants links to any of this, I'm happy to provide any of the links so that you can see what the docket opening looks like, and you can see the progress, because regardless of whether you're a committee or not, you're still part of the public. So you have access to all of that, and you can readily see all of that. We did open a docket for the mental health parity rules on September 11, 2020. So we would have 1 year to file a proposed rulemaking. So that's what brings us to our second step, which is filing a proposed rulemaking. So once a docket is open, the agency now is, as Lynette said, feverishly working to create the rules. And so we have been working very hard since that docket opening to write the rules, add the exhibits. We did have a listening session with the insurers and got their input on our proposed exhibits. And in the meantime, we've been working very, very diligently to try and get these rules put in a format that is understandable and guides the general public on what needs to be done with regard to mental health parity. Mostly it's in guiding the insurers. Once we get a proposed rule ready to go, then we file another notice. This is the second step with the Secretary of State that lets the public know what the content of our rule is. So all the verbiage that's going to be the rules and the exhibits will be filed with the Secretary of State. The Secretary of State will publish that in the Arizona Register again, and that will notify the public that this is what we would like to enact. These are the rules we want to enact. Now, there is a requirement that says once you publish a proposed rule, you have to wait 30 days. And if any member of the public requests a hearing on the rule or the rules, then you have to conduct a hearing within 30 days. So in this case, what we're going to do is, since we're on such a short time frame, the legislature has asked us to enact these by April 1st, 2021. We are going to, when we publish our proposed rulemaking, we are going to automatically set a hearing date for 30 days after the publication date. So we can eliminate a 30-day delay that we would normally have in a proposed rulemaking. So if someone requests, so we're going to have a hearing, it will be a public hearing, it will be recorded, and we will also, when we publish our proposed rulemaking, we will provide an email address so that members of the public can also submit public comments. So we can consider all those public comments and make adjustments to our rules based on the input we get from the public. If unfortunately we have to make large substantive changes to the rules because of the input from the public, we would have to start over with the proposed rulemaking and submit another proposed rulemaking to the Secretary of State. But hopefully, we did have a listening session with the insurers early on, and hopefully we are in sync with what they want, and we won't have to make large substantive changes. So then the third step is we submit what we would consider the final rules that we want to publish in the register. We submit them to the Governor's Regulatory Review Council, and they're a branch of the governor's office, and they review the rules to make sure that they meet certain standards. And they also conduct public hearings so that there's another opportunity for the public to come and comment on the rules in the event that we have not addressed what some of the public has brought up as a concern about the rules that we have written. We will make every effort to address every comment that is brought up to us, but there's another opportunity, like I said, for the public to be involved in commenting on the rules that we're proposing. So that's the final rule. Once we get the approval from the Governor's Regulatory Review Council on our final rulemaking, then the fourth step is we submit that final rulemaking to the Secretary of State again. That gets published in the register, and that is the rules that will end up in the Arizona Administrative Code. There is a delayed effective date on those of 60 days, but if we meet certain statutory requirements, we can get an immediate effective date on them. So that's generally the 4 steps of rulemaking. We are in step 2 right now. So any questions? I know it's complicated. It's not a fun process.
Mary, this is Erin. I just wanted to acknowledge that we had 2 listening sessions. We had one with the insurance stakeholders as well as mental health care provider stakeholders. So
yeah, I only participate in one, so that's why I remember.
Right.
Okay.
Right. So, I don't know if you said it, I missed it. Our goal is to have the draft, the proposed rule published shortly after the holidays. So just to give everybody a little idea of the time.
So there's some built-in delays on all these processes. So anything we send to the Secretary of State, they don't publish for 3 weeks. Anything we send to the Governor's Regulatory Review Council, it takes a month to get onto their agenda. So, we hope to send over the proposed rule like beginning of January to get on, get into the register by the end of January, but there's just going to be that, these built-in delays. It's government. They have to do that. So it's just going to be, there will be some delays, but I think that with regard to the proposed rule, we are very, very close to being able to finalize or at least have a proposed rule that we're happy with. And I'm sure we'll run it by Evan, and Lynette's been involved in this process, and Mary's been involved, and Erin's been involved. So we will, I think we'll have something that's a very viable rule package to be able to send over sometime soon after the holidays. Yes.
Okay, Mary, thank you so much.
You're welcome.
Any questions for Mary? Comments? I know it's a lot of information involved in that.
Well, if anyone wants to see our package before we send it over to the Secretary of State, I'm happy to share that with anyone if they'd like to look at it. When you send it to the Secretary of State, it's kind of in a funky format, because they need everything double spaced. So, but what I had planned on doing is also putting a readable format on the website. We do have a page on the website that has to do with rulemaking, and I would like to put I've talked to since we've merged, there's some, housekeeping things that we're trying to iron out. But I've talked to the people who deal with the website, And we will be putting, links to docket openings, links to proposed rulemakings. And then for every proposed rulemaking, I'd like to put a readable format so it's much easier for somebody who's not familiar with the crazy format that the Secretary of State needs. So it's easy for them to understand and read the exhibits and the rules. So I'm hoping to do that and put that on the website.
So, Mary and Lynette, this is Erin. Just a couple of comments. I think, Mary, we'll have to kind of talk about the point at which we're going to feel comfortable actually releasing a copy of the rule. For sure, when the proposed rule gets sent to the Secretary of State, we will absolutely put a link to it on the mental health parity page of our website, as well as any other pages, pertinent pages on the agency's website. But I think we'll have to talk about that, Mary. If before we move on to the next agenda item, Lynette, if you would forgive a slight interruption, I wanted to acknowledge a couple of other folks that are, I'm not sure if both of them are on the call, but we kind of missed them when we were doing introductions. We have two other state agencies that are very involved, as everybody will appreciate, with mental health parity issues, and that's Access and the Department of Health Services. And we do have somebody from Access. Director Snyder was not able to join us today, but we have Dana Flannery, I think is her name. I don't know if Dana has logged in a way that we can unmute her. If she would like to identify herself and introduce herself, that would be lovely. If she's not able to, then I'm not. Mary, do we have the ability to unmute Dana?
Can you hear me?
Yes.
Mm-hmm. Yes.
Hi, good afternoon, everyone. I'm Dana Flannery, and I'm the Senior Policy Advisor at Access, and also the Assistant Director for our Division of Community Advocacy and Intergovernmental Relations. Happy to be here.
Thank you. And also from Department of Health Services, we had, there was an individual who was interested in the insurance division's rules and other things. I think her name is Odette Colburn, but I'm not sure if Odette is on the call today. Mary, do you see her? Are you able to unmute her if she's here?
If she is here, she is not identifiable. Okay.
All right. Well, I did actually, this is kind of a segue for the future agenda topics, probably. As you saw in the scope of the advisory committee purpose, it's not only to advise the insurance director, but also to advise the director of the Department of Health Services. So I'm sure that we will have participation in future meetings from DHS folks, and just wanted to acknowledge their collaborative input as well. Thanks, Lynette. Sorry to interrupt.
No problem. Thank you, Erin. Welcome, Dana. Moving to future topics. What future topics would you like to see on the agenda for either our next meeting or a couple meetings out? The rules, the status of the rules will probably be a standing item because we want to stay on top of that. Any other future topics?
And again, just as a reminder, you can raise your hand by hovering in the participant list near to your name and just a little bit to the right of your name.
Are you sure there's nothing you want to advise us on? Well, I think by the next meeting, I'm hopeful that we will have a proposed regulation that's been published. And I would expect that we'll bring that out and give folks an opportunity to talk about what's in the proposed rule. At a minimum, I think we can do that. I don't know.
It looks like we have a couple of commenters, Erin.
Good. Yeah. I'll be.
Carly here. I'm not looking at the bill right this minute, but I know DHS has some rulemaking that they have to do as well. So I'm not sure when we'll get into the guts of like the discharge planning, et cetera. Does anybody have any information on that?
I don't have any immediate information right now. I'll have to look at it as well to see.
I think they are working on rules as well. I don't know where they're at in their timeline, but we do know that DHS is also in the process of working on their rules. And so, Carly, are you thinking that it might be good to have DHS on a future meeting agenda to kind of give an update on their rules? Is that something you'd like?
Okay.
Carly's got her hand up.
Yes.
I have that.
Sorry, that would be great. And then also just because I'm sure, especially with the providers that are part of the committee, that they will have some great ideas for, making sure that the right information is kind of uniformly offered to families who have a loved one, that's in crisis, and making sure that those folks are ready to leave when discharged.
Yes.
So discharge planning.
Mm-hmm.
Okay.
And then I saw Vista had her hand up.
Right. I'm assuming that the sort of the website and consumer information and the content for that will be an ongoing topic, maybe to begin to formulate a list of sort of critical subject matter pieces that would be right for the website and consumer information.
Okay. Kathy also made a comment in the chat about interaction with DHS and discharge planning. I have that, Kathy. There's also a recommendation about telehealth expansion and a public health emergency as an agenda item. Any other ideas for future topics?
I see a lot of hands up, but I'm not sure if they're from an earlier episode. Don, Monica.
Mary, are we all caught up?
I did just have a question. I'm sorry. I was trying to raise my hand. I think I'm doing this wrong. I just was, and forgive my confusion, I just want to make sure I'm clear. So when will the proposed rule draft be, the rule draft will be brought to the committee for our review? I wasn't sure how many different topics were going to be part of that draft.
In the rule?
Yeah, I was just, yeah.
Well, the rule is covering a number of things, but predominantly the reporting requirements that the insurers are going to have to comply with, as specified in Jake's law. That's the general category of what's going to be in the rule. But the proposed rule, as soon as it's published, we'll bring it back to this committee so you guys can discuss it. But of course, with rulemaking in general, as Mary said, it's very transparent. There will be an opportunity for anybody to give comments on the proposed rule. The department will probably, we will have an email address that will be included when we propose the rule that anybody can submit written comments to. So if this committee wants to discuss the proposed rule, we would, it would be kind of an informal discussion. You could ask questions, make comments, but then any official comments on the rule would have to be submitted to the email address in order to be considered a comment on the rule itself. I don't know if that helps, Monica.
Thank you. Yeah, I just couldn't remember the scope of the topics for the rule, so that's my fault. Thank you. That's very helpful.
Okay, good.
David has his hand up.
Yes, I guess going along the same lines we were talking a little bit earlier about discharge planning, and I think one area in respective to kids that are not going home, adolescents that aren't going home, is the whole aspect of placement. Particularly, we talk about residential treatment facilities and group homes. If we're talking about keeping kids safe and families moving families together, there's a lot of challenges with that in that we don't have a lot of residential treatment or group homes in the Phoenix, Arizona area. Many kids go outside of the state. And so when we talk about mental health parity and treatment and so forth, it's virtually impossible for families to work on family issues if children are not even in the same state in which the family resides. So I think there's certainly a place to look at that possibly.
Okay. So placement issues specifically related to children and adolescents.
Right.
Okay.
Yes.
Anyone else? Making sure we didn't miss any comments.
I'm not sure if I'm on or off mute.
I can.
Okay. I wanted to get clarity, and maybe this is part of what you guys are going to discuss offline, but on the rules, before you formally propose them, are you going to have time to incorporate one more sort of round of informal?
No, Vista, the timeline is too tight and we're already behind schedule. So we did take all of the feedback that we got during those 2 listening sessions. We took those very seriously, made a number of changes to things, and that's what you're going to see in the proposed rule. But we just don't have time to do one more draft and kind of open the draft up for public comment. So given that we're supposed to have rules by April, we've got to get the rule making moving. So we're going to actually publish the proposed rule next, and then you'll have an opportunity for comment.
Got it.
Okay, thanks.
Monica, did you have your hand up again?
Yeah, I did.
Okay.
Thank you. Just to one of the points made earlier about placements, and I was wondering if it might be something that we could have presentations perhaps from ACT or other agencies who could give us an overview of the landscape, and maybe Kathy Busby's on from the Council of Human Service Providers, just to see how many behavioral health providers we have in the state, how many of those providers are contracted with Access primarily and not as much with the commercial insurers, just to provide a little bit of context for us, because I think it seems to me anyway that there are a lot of providers who maybe focus mostly on access and other providers who don't do any access and are self-pay or commercial insurance. And so I was just trying to get a sense of how much what it looks like out there, what the provider landscape looks like out there.
Kathy, are you still with us?
Yes. Can you hear me?
Yes.
Okay. Yeah, along those lines, Monica, I had some of the same thought. Some of this gets into more access, which is a different kind of topic. But I think maybe just knowing what's out there would be helpful also for the insurers to know and to get a little more scope of the landscape. I think that it's also something, and it goes along with the levels of care, also the discharge planning, which was part of the bill, and that's in the DHS realm particularly. And so perhaps something with getting them involved would help on some of these topics that get a little more into the DHS side or access side too.
It sounds like too you're looking at a capacity issue to see what the capacity level is from the access side as well as commercial.
Yeah, and it might
Monica?
help DHS to know just who's licensed out there as what. I mean, that they might be useful in that discussion.
All right. Anyone else? I just saw a pop up for someone else's hand is raised. Mary, I see your hand up.
Yes, thank you. One of the things I think we'll have to, make an effort to keep straight is the scope of the rules that DHS is writing versus the scope of the rules that Department of Insurance and Financial Institutions is writing. So the scope of our rules is really having to do with reporting requirements by the insurers to verify that they are complying with the quantitative treatment limits, the financial requirements, and primarily, and the emphasis is in our rules versus what other states are doing, is on the non-quantitative treatment limits. So those really encompass the scope of the Department of Financial Institution, Insurance and Financial Institution rule, and that would be distinct from the scope of the DHS rules. So we might want to just keep that in mind when we're talking about the rulemakings, because they're two separate rulemakings, and the subject matter of each is going to be slightly different.
Hey, Mary, this is Carly. I know I understand that, but the reason I brought up discharge planning is because that is under the scope of this committee, and therefore I want to make sure that those items don't get lost in the shuffle, because it does seem that the Department of Insurance and Financial Institutions is kind of the coordinating body for Parity, and it gets a little bit wonky because there are other parts to Jake's Law that this committee itself is supposed to provide advice for. So that's why I brought it up, was to make sure that those particular folks are brought to the table. Does that make sense?
Yeah, sure. Thank you very much for that. I just wanted to set the expectation level so that, when you do review our proposed rule, that it's not going to be deficient in your mind, that it is addressing what we need to address on the insurance company side and what they need to report. And I know that the exhibits that Mary Boatwright put together allow us to monitor a number of different types of things that the insurers are providing parity for. So we should be able to at least, know that the insurers are addressing some of these issues that they're required to provide on parity. So,
Carly, thank you for the comment you just made too. I'll just reiterate again that we think the way we envision this working at the moment is that because the advisory committee, you're right, is a little confusing. The advisory committee is kind of housed in the Department of Insurance and Financial Institutions. But you're right that the committee is absolutely supposed to be accessible to advise the Department of Health Services as well. And you're right, those topics of discharge planning and placement and some of those other things really have more to do with DHS activities, perhaps, than they do specifically with insurance requirements. So I think what we're envisioning is that we will partner with DHS to participate in future meetings, bring agenda topics to us, and then we can have those conversations, and DHS can kind of make sure that they're getting what they need to from the advisory committee to help them with the topics that pertain to their agency. Does that make sense?
Yeah, absolutely. And I appreciate that. I just want to make sure that when our committee meetings come up, that those of us who are supposed to be providing advice have sort of ample time to prepare for the topics that we may be addressing. And so, and just making sure that things don't fall off the radar. So that's all. Thank you. Appreciate it.
Absolutely.
Thank you.
Thank you, Carly. We want discharge planning is a very heavy topic with a lot of moving parts. Yeah, thank you. We'll make sure we keep eyes on Monica. I see your hand up again.
Yeah, I just to that point, because I appreciate that clarification, because I was trying to work through the scope of the committee as well in my own mind. But at the very least, I definitely think that for the website, the public is going to have some expectation of basic information related to Jake's Law on the department's website. So we probably might want to think about how best to have something around discharge planning available on the website when we're putting that together.
Thank you. And there is an area currently that just has I guess if you want to call it a tab. There is a tab specifically for Jake's Law on the website. We're just building the content to go there. So as the committee meets, we can decide what should live there, if it's discharge planning stuff, as well as just the overarching understanding of what Jake's Law is, how it came about, and the story behind it. If we need to put other things there, it'll link to that. Anybody else?
Yeah, Lynette, this is Don. Just a couple comments on the agenda and the website. I think one thing is to be as facts-based as we can be. And so when you start looking at numbers of providers and capacity and all, it speaks to network sufficiency and capacity and all that kind of stuff. I think it does help to look at it by market type, Medicaid, Medicare, commercial, but also state to state. Because one of the things, just a quick concrete example, nationally, Arizona gets a rap for a weak mental health system. When you're back on the East Coast and you hear about what people don't realize is we have one of the better funded, better Medicaid systems in the country. And that gets lost sight of all the time. And when you bring it to people's attention, they're a little surprised. And when you quote some numbers, they're like, "Oh, wow, we had no idea." And so I do think it's good and I think it's good for everyone, because this issue comes up all the time, and there are different schools of thought and views on it. It's like, oh, we don't have enough psychiatrists, we don't have enough, whatever. And then when you look at the numbers and even comparatively, it shows a little different story. And also it points to some potential solutions like telemed and telehealth, all that kind of stuff. The other thing too, on discharge planning, to the extent on the website or as an agenda item, I think, the contributions to discharge planning come from different places. It's not just a managed care problem or issue, and it's not just a provider problem or issue too. So I think to the extent we can show that we're looking at, root causes and looking at it as holistically as we possibly can, because I think there are some barriers on, throughout the process that, occurred at the provider level, but also at the administrative level. And I think to the extent that we can do that, we'll probably be better served.
Thank you. Or agenda topics. I'm sure we could do discharge planning for the next year or so.
Yes. And
okay. Future meetings. We want to be as time sensitive as possible. I understand everyone has very busy schedules. What time of day is best? I imagine for the first few months we'll meet monthly as far as frequency, and then as we get our bearings, we'll probably meet either every other month or quarterly. But to start out, is this a good time for everyone? And since we don't know when we're going to be an in-person thing again because of the pandemic, it'll still be a virtual setup like this. But is there a better day than others? I know that work, I know mom thing, parent thing, soccer, I know all come into play.
Dr. Henning?
Evenings can be challenging. Yes, ma'am.
Yeah, one of the things, at least I thought of as far as this time, it was that once we get into January and February, I know that the House Health Committee is meeting on Monday afternoons. So at least we schedule. So it just might be if this works with people, maybe move it back just a little bit earlier, because there might be things that are going on there that some of us may want to participate.
On Monday. So if a different day of the week, I'm better.
I didn't have a problem with that. Yeah, just thought I'd bring up that one issue of the Mondays look good.
So I know that there are people with very different types of jobs than I have, but for me, Fridays usually tend to be the most relaxed. And lunchtime is always good since, presumably most people have some kind of lunch break. But I mean, I also want to be sensitive to somebody like Angela who has, works in a hospital setting, and I don't really know what her schedule looks like, except that I think she often works nights. So, I don't want people to get wrapped up around what my schedule looks like, but I will say that Fridays are usually the easiest, most accessible for me.
Perhaps we can do like a doodle poll thing where you put some blocks out that work for you. See what works best for folks.
I can definitely send out a poll for our next meeting.
I think we were just hoping that if there was, if the majority of us, well, first of all, should we be looking at, say, a 5:30 p.m. time to accommodate the family members or medical providers? That was one of our concerns. If not, if everybody's good with kind of a lunchtime, I imagine some of our meetings will probably go 2 hours, which may make a lunchtime meeting a little difficult. So middle of the day or evening? I guess that's the first question. Does anybody have a strong feeling about that? I think we'd like to get this on kind of a standing committee schedule if we can.
Absolutely.
I heard one vote for lunchtime on Fridays.
I see 2 for lunchtime.
Okay. Lunchtime is sounding good.
I'm okay on Friday with lunchtime. Monday might be problematic.
Okay.
Carly?
I'm seeing Angela has her hand up, and I wanted to make sure she gets an opportunity to speak. So.
Oh, am I? Can you hear me?
Yes.
Oh, okay. Yeah, Carly was right. I do work nights. I'll make whatever work if it has to. But Fridays usually I'm off Thursday nights. And lunchtime works for me. But if it's a different day or time, I'll make what works work. I'm a mom. I'm used to adapting.
It's sounding like Friday at lunchtime might work.
Friday at lunchtime, it looks like it is. Might be the winner. And again, the next meeting we can try Friday at lunchtime. And if that happens not to work, and for the next meeting we have to switch it around, it is it's fine with me. We just want to find a good landing spot so it's not always different. So we can try with the Fridays. At lunchtime, I saw another thumbs up for Friday at lunchtime. All right. Friday lunchtime. Do we want to pick a Friday now while everyone is on? Let me see if I can pull up my calendar.
Lynette, this is Mary Kaczynski. I was going to say, is it going to be like the third Friday of the month, the second Friday of the month, every month? Since I think you said a monthly meeting.
Let's do the 3rd. So that would be the 15th of January for our next one. Does that look good for everyone? I'll send out something official, but just getting general works.
I don't know if the rule will have been if we may have submitted it for publication to the Secretary of State by then. So if I will have to make sure that that's something that we're going to be able to, we might want to consider pushing it a little bit if need be, but
Erin, we might also have plenty to talk about the website. So
that's true.
To not have try to sandwich that in with a long rules conversation later.
That's true.
All right. So January 15th at 12 noon, going once, going twice. Sold. Any last questions or comments before we adjourn? Very exciting. No? Well, I thank everybody for participating. Erin or Mary, do you have anything before we adjourn?
Which Mary? I don't.
Mary B.
No.
I do not.
Okay. I forgot we have like 5 Marys. Erin, do you have anything?
Only that we may have a slightly, we're working on some kind of technology platform that won't be quite so cumbersome with the raise hand stuff. I don't know if we'll have it in place by the next meeting or not, but thank you for your patience with the, we're working through all of this, really appreciate it. And just thank you everybody for your time and commitment and compassion. And I hope everybody has happy holidays because we won't talk to you before then. So thank you.
Yes, thank you, everyone. Everyone, hopefully, will have a happy holiday. Don't eat too much. Make sure you stay safe. For whatever holidays look like this year. And we will talk soon. If you have any questions, don't hesitate to reach out to me via email. And we'll see everybody on January the 15th. Yay! Our first meeting is in the books. Thank you guys so much.
You.
I wasn't.